The hospital theater was usually a place of careful routine, where every nurse, doctor, and patient had a role to play. But once a week, everything changed. That was the day Dr. Mira, the surgeon everyone both admired and feared, walked in. She was efficient, too efficient, some would say. She didn't care if the nurses hadn't eaten, if the coffee hadn't kicked in, or if someone's feet were aching after hours of standing. Her motto seemed to be, "The surgery comes first, everything else can wait." One day, the hospital implemented a new patient management system. The nurses were scrambling, checking lists, calling patients, and trying to keep the queues organized. The pre-op area was crowded, people waiting patiently. But Dr. Mira had no time for lines. She marched past the chaos, hand-picking patients herself and whisking them into the theater. "No time to wait," she snapped. The matron, sharp-eyed as ever, had to intervene to remind her of the rules. Dr. Mira paused for a moment. She had her favorites too. Female nurses got her nods and smiles. The men mostly got her frowns or cold stares. Her associate, Dr. Rajan, was full of advice, or sometimes just talk. But Dr. Mira had zero tolerance for chatter. "Stop talking," she would shout, mid-surgery while flipping through patient notes. Even the most mundane remark could earn a stern glare. And then there were the days that truly tested the Team S nerves, when she began a surgery without a scrub nurse. The theater fell silent, save for the clink of instruments being passed quickly from nervous hands. Nurses exchanged glances, holding their breath. But they adapted. They covered, corrected, and whispered reminders, silently protecting the patients from being swept away in her whirlwind. Through it all, the team learned a vital lesson. You could never predict what Dr. Mira would do next. Yet in that unpredictability, the nurses found strength, teamwork, and quiet courage. They learned that even under the most chaotic leadership, patient safety and compassion were their own responsibility, and nothing could take that away. And somewhere in the middle of all the shouting, rushing, and quirks, they laughed too, because theater life, as stressful as it was, always had its own strange rhythm.